Hi, I'm Dr. Ben from Mornington Peninsula Chiropractic Centre, and in the third video on spinal discs I wanted to talk to you about the different treatments that we often use to treat spinal disc injury. Now, as we talked about in the first video, there's a couple of types of disc problems. One is a disc where the disc bulges and starts to compress the nerve and causes that radicular pain down the arm or leg, or even just the second problem, which is just the localized disc problem from degeneration or arthritic change. And then of course we have the different tests or examinations we perform, from neurological examinations to physical examinations to a detailed history, or even to diagnostic imaging tests like CT scans and MRIs. And once we've put all that information together, we then need to decide, is it appropriate that we treat this condition either through chiropractic care, is it appropriate we treat it through some kind of drug therapy, or is it appropriate that this case is referred for surgery? And they're kind of the three treatments, and the most common one of course is to do physical therapy, that is chiropractic therapy. Try and restore normal functional motion to the joint. This can be incredibly effective, and we do this through very gentle spinal adjustments. In our practice we actually use a very special table called a flexion distraction table, which has been shown to help open up the disc and cause almost a suction effect and help that nuclear material restore its normal position, taking the pressure off the nerve. And in a video coming up in the next few weeks I'll be putting together a video on explaining this incredible table that we use in our practice and the flexion distraction technique. Of course, drug therapy is important sometimes to reduce the inflammation. So when a disc bulges, the nuclear material within the disc is incredibly, if you like, toxic, and can create a massive inflammatory reaction to the surrounding spinal nerves. And so often we need to treat that inflammatory process with drug therapy, and that might be non-steroidal anti-inflammatories, or even a steroidal anti-inflammatory like cortisone, to help reduce the severity of the inflammation as we go through the physical treatment process. And then lastly, sometimes the disc has been so damaged that the disc nuclear material has ruptured to such a point that it's impossible to restore its normal position and function, and the pain can be quite severe at this level, and unfortunately the only way to treat that is through spinal surgery, which can be effective, although of course there are complications. So they're the three options: physical therapy, drug therapy, and of course spinal surgery for this. Always important to get your spine checked by a professional who is experienced in looking after spinal complaints like disc injuries, and of course a chiropractor is best positioned for that. And make sure that the treatment that you choose to go through, the path you choose to go through, is appropriate for your spinal condition. Remember, look after your spine. I'm Dr. Ben from Mornington Peninsula Chiropractic Centre.